Frailty is a measure of several factors, and they can be measured along a scale, and they can include muscle weakness, low physical activity, slow walking speed, exhaustion, and also weight loss. On patients who score, let's say, a 4 or 5 out of these, they're considered frail. Those who score 2 to 3, intermediately frail, and those who are 0 to 1 of these will be either pre-frail or not having frailty. In a previous video, I went over the risks of having muscle atrophy or poor aerobic function with the outcomes and the risk of complications after surgery. However, being frail is even more concerning because by definition it involves several biologic and physiological systems that are not working well. For example, there was a study of 600 patients, and they found that patients who were frail had a 2.5 times increased risk of postoperative complication compared to those who were non-frail. In this video, I reviewed the post-surgical risks associated with someone having frailty before having surgery. Hi, I'm Dr. Edmond Cleeman. I'm an orthopedic surgeon here in New York. I specialize in sports medicine and arthroscopic surgery. In orthopedic surgery, patients who have hip fractures and are frail have been found to have significantly increased risks. For example, a study of 180 patients with an average age of 81 were prospectively evaluated. And they found that about a third of the patients had significant frailty, a third were intermediate frailty, and a third either didn't have frailty or were very low on that scale. And they found a significant impact on mortality after surgery. So those who were the fittest in that top third, none of those patients had died in the hospital. In the group that was intermediate, about 3% died within 30 days after surgery. And the third of the patients who were the most frail, about 17% of those patients died within 30 days of that surgery. Now, another common reason for older patients to need surgery is cancer surgery. And statistics show that in 2023, it's estimated that about 150,000 people will be diagnosed with colorectal cancer. And about 55% of those patients are over the age of 65. Now, complications post-colon surgery for cancer is also associated with frailty. A study of 58,000 patients who either had laparoscopic or open colectomies, they found that as the frailty index increased, the proportion of patients with a severe complication also increased from 3% in those who did not have frailty all the way up to almost 60% in those patients that did have frailty. The costs associated with undergoing these types of procedures increases significantly as a person's frailty index increases. And it makes sense because those patients are going to more likely have complications which require more care, and it will typically take these patients longer to recover, again requiring more care. And there was a study of about 60 patients, average age 75 years, undergoing colorectal surgery. So with advancing frailty, they found that hospital costs increased, the cost from discharge to 6 months increased, higher degrees of frailty were related to increased rates of discharge institutionalization, meaning that they didn't go home, they ended up having to go to some institution, and higher degrees of frailty were related to increased rates of being readmitted to the hospital within 30 days of their surgery. In addition to complications and higher medical costs, survival after these type of surgeries is also linked to their frailty score. And there was a study of 13,000 patients over the age of 80 undergoing colectomy for stage 1 through 3 colon cancer. And they were evaluated. And they compared overall survival for those patients who were frail versus those who were not frail. And they found that survival in those patients who were frail was only about 59% versus 95% survival rates for those who were non-frail over a 90-day period. So that's a significant difference. And then looking at the overall 1-year survival rate, they found that only about 41 to 42% of patients who were frail survived versus 87 to 88% of survival rate in those who were non-frail. So again, significant differences depending on patients' frailty scores. After surgery, ideally someone will recover quickly enough so they can get out of the hospital, go home, and do the rest of their recovery at home. But we see in these studies that those patients who have frailty, high levels of frailty, unfortunately, they get stuck in the hospital longer, either because of complications or it just takes longer for these people to recover. And when using frailty as a measure, patients who have an intermediate level of frailty have a 44 to 50% longer hospital stay than those patients who are not frail. But those patients who are frail have a 65 to 89% longer hospital stay compared to those who are non-frail. So these are big differences in terms of how long someone's going to get stuck in a hospital. Now, additionally, the need to be sent from the hospital to a skilled or assisted living facility versus being able to go home also is significantly linked to whether or not someone is frail. So in those patients who are not frail, about 3% of them end up having to go to a facility versus 12% of those who have an intermediate level of frailty. And then there are a whopping 42% of patients who are frail end up needing to be discharged to an assisted living facility versus being discharged home. After orthopedic surgery, we see a very similar pattern. In a study of 178 older adults with an average age of 81 and treated surgically for a hip fracture, their overall length of stay, either in the hospital or rehabilitation ward, averaged about 21 days for those people who were not frail. But those patients who did have frailty high scores, they were in the hospital or in a rehab center for 68 days. So again, a significant difference, almost 3 times longer. Additionally, the study found that 80% of those patients who were not frail were able to return to independent living within 30 days, versus only 6% of patients who were frail being able to return to independent living that quickly. Let's wrap up this video and go over a few key points. Number 1, frailty is a measure of several factors, which can include muscle weakness, low physical activity, slow walking speed, exhaustion, and weight loss. Number 2, frailty is associated with post-surgical complications. Number 3, frailty is associated with postoperative mortality, meaning death. Number 4, frailty is associated with longer hospital stays or rehabilitation facility stays, and it is more likely for those patients to need to go to an assisted facility versus being able to be discharged home. And number 5, maintaining a physically active lifestyle, including aerobic exercise and resistance training, is important for older people to help prevent them from becoming frail. Thank you for watching this video. I hope you found it helpful. If you did, please click the like button below and subscribe. I look forward to seeing you in my office or in my next video.